Good morning, everyone. Very good to see people here. Very pleased to be able to welcome today to beautiful Niagara the Premier of the Province of Ontario, Doug Ford, the Minister of Heritage, Sport, Tourism, Culture, Industries, the Honourable Lisa MacLeod, a friend of Niagara's and a friend of mine, and of course the Minister of Finance, Peter Bethlenfalvy, who last week presented a budget before the legislature, a budget that invests in protecting the health and safety of Ontarians while also ensuring that our economy is protected and kept strong going forward. As many of you know, Niagara has been hit extremely hard by COVID and of course the economic consequences of COVID. Today we're going to be hearing some good news that's been in the budget presented to ensure that Ontario and Niagara are kept safe moving forward and that our economy and the jobs that so many in the Niagara region depend upon are ensured that they're also protected going forward. So without further ado, I wish to turn it over to the Minister MacLeod to say a few words.
Thank you, Sam. It's great to be here with you in Niagara, alongside our leader, Premier Doug Ford, and our friend, Minister of Finance and Treasury Board President, Peter Bethlenfalvy. This past year has tested the resiliency of Ontario's heritage, sport, tourism, and culture industries unlike any other. They were hit first, the hardest, and are expected to take the longest to recover from the pandemic. While traveling the province last summer, it became clear to me that they face a triple threat: a public health crisis, an economic crisis, and a social crisis. These crises have severely impacted operators of all sizes and in every region of the province, from the large-scale attractions here in Niagara Falls to the many small family-owned bed and breakfasts in the north and everything in between. Pre-pandemic, the sectors I represent supported a spectacular double bottom line: $75 billion in economic activity and a unique social fabric felt in every single community across this wonderful province. Today, they're working to recover more than $20 billion in lost revenues and hundreds of thousands of jobs, including right here in Niagara Falls, a city of 90,000 who lost 40,000 jobs during this pandemic. And our government has acted to support them. We flowed more than $62 million to protect our iconic tourism institutions. We launched a new $105 million community building fund to support nonprofits. We provided $2.5 million to increase museums' digital capacity, committed $25 million to help our artists and our arts organizations, and dedicated $1.5 million to the new Tourism Development and Recovery Fund. We provided $2.5 million for the love of live music, more than $10 million for innovative festivals and events, and $15 million to support our sports sectors, and much, much more. Combined with the supports outlined in the 2021-22 provincial budget, we're providing nearly $1 billion to ensure Ontario remains the best place in the world to live, work, play, and to visit. This funding will go to a suite of sectors who have demonstrated sheer resilience, creativity, and innovation during this pandemic, a true testament to the Ontario spirit. Many of the athletes, artists, and attractions I represent told me they cannot recall a time when their livelihoods were the centerpiece of a provincial budget, particularly to this magnitude. The investments in this budget will allow us to recover, reconnect, and rebuild with the aid of our Tourism Economic Recovery Task Force and our upcoming 5-year plan. That recovery starts today at Canada's premier tourism destination, known the world over, right here in Niagara Falls. I'll now turn it over to Premier Ford and Minister Bethlenfalvy to tell you more about how Ontario's action plan is working to protect the lives and livelihoods of those in Ontario's hardest hit sectors. Premier?
That's great, and good afternoon, everyone. And thank you, Minister MacLeod, for that introduction. And thank you for all you've been doing during this pandemic. You've been doing an incredible job for the tourism sector. I can tell you, Lisa has been working non-stop during this pandemic on your behalf. She's been a strong advocate for the tourism industry, making sure my cabinet and I know exactly what you need to get through these trying times. I also want to acknowledge Peter Bethlenfalvy, my All-Star Minister of Finance, and Sam Oosterhoff, our MPP for Niagara West. I also want to thank Niagara Falls Mayor Jim Diodati. And I need to give a special shout out to Bart Maves. Bart has been an absolute champion for the people of Niagara for a long time, and he knows this area better than anyone. So Bart, thanks for everything you do to continue to do, and please keep it up, because there's a lot of work left to be done to get Niagara back on its feet. Because, as we know, the tourism sector has been hit harder than any other sector during COVID-19. It has been asked to sacrifice so much to keep us safe during COVID-19. The impact on individuals, families, and operators has been absolutely devastating. More than 200,000 jobs and more than 18 billion in revenue has been lost. Clearly, this sector is down, but it's not out. I know it will recover. I have such confidence in the people of Ontario, but it will take time and it will take help. You can be sure our government will always be there to support and protect our vital tourism industry. In our 2021 budget, Ontario's action plan, we made a commitment to protect people's health and protect jobs. To help us achieve those goals, we're investing $200 million to support our tourism industry, to see them through this difficult time. This includes $100 million for a new Ontario Tourism and Hospitality Small Business Support Grant, and $100 million for a new one-time recovery program. We have created these programs to help our large, medium, and small businesses during this very difficult period, because our commitment to supporting businesses is unwavering. In the budget, we also announced an additional round of support through the Ontario Small Support Grant to help eligible employers impacted by difficulties and necessary public health restrictions. This will now deliver $3.4 billion to approximately 120,000 eligible small businesses in Ontario, to help them get through this extraordinary period and continue to protect vital jobs. We made a promise to make sure every business is supported and well positioned to contribute to our economic recovery once this virus has been beaten. And nothing will stop us from keeping that promise. So whether it's the tour boat operators down the river, the motel up the road, or the lodges up in Northern Ontario, we are here for you. We've got your back, because we're all in this together as part of Team Ontario. Thank you, and God bless the people of Ontario. I'll pass it over to Minister Bethlenfalvy.
Well, thank you. It's just so amazing to be standing here behind with this backdrop, and also with the incredible Minister MacLeod, who's doing such a great job, Premier Ford and Sam. You guys are doing incredible work. While the world has changed in the past year, our government has remained steadfast in its commitment to do whatever it takes to defeat COVID-19 and keep people safe. As the pandemic has continued to unfold, people have been very clear that they expect us to focus on two vital priorities. First and foremost, they expect us to protect the people's health, your health. And second, they expect us to protect our economy, your economy. And that's exactly what the 2021 budget does. We know that hardworking tourism, hospitality, and cultural businesses and workers have been particularly affected by COVID-19, which is why we are introducing the $100 million Ontario Tourism Recovery Program as part of the 2021 budget. The budget also introduces a new Ontario Tourism and Hospitality Small Business Support Grant, which will provide an additional estimated $100 million in one-time payments of $10,000 to $20,000 to eligible small businesses. Our support for these industries doesn't end there. In fact, through the 2021 budget, Ontario is investing an additional $400 million over the next 3 years in new initiatives to support the tourism, hospitality, and cultural sectors. This builds on previously announced investments of $225 million to support these hard-hit sectors, bringing the total to more than $625 million since the pandemic began. Overwhelmingly, the people and employers of our province have done what it takes to protect each other from COVID-19, even when these sacrifices have impacted their livelihoods. This is especially true in the tourism, hospitality, and cultural sectors. And we recognize these sacrifices. And in the 2021 budget, we are taking further steps to provide direct support to the families, workers, and employers who have sacrificed so much. The 2021 budget brings the government's total investment to protect Ontario's economy to $23.3 billion. That's just part of Ontario's total response to COVID-19, which is now $51 billion over 4 years. Our focus is on protecting health and jobs today and setting the foundation for sustained success in the long run for the tourism, hospitality, and culture sectors, and for the province as a whole. Because we know that economic growth is the way that Ontario will recover stronger from the pandemic. There is hope on the horizon. Ontario will emerge stronger, and communities that make Ontario a great place to discover, like Niagara, are going to play a critical role in making this a reality. Thank you.
We'll go to the phone line for questions. First question, please.
Mike Crowley at CBC News. Please go ahead.
Hi, Mike.
Premier, the postponed March break is now coming up. It's just 2 weeks away, and we're actually sitting in a situation where the number of infections happening every day is much higher than it was at the middle of March. What's your government's thinking about whether you need to postpone this break as well, because that was what you said was the right thing to do back in mid-March to keep the kids safe?
Yeah. So the minister will be keeping a sharp eye on it, as well as myself and the chief medical officer. And I just might be very frank, I don't want to predict 2 weeks out, but we'll be out here every single day communicating with the people. I can't give you a direct answer right now, 2 weeks down the road.
Follow-up?
And Premier, I don't think we've heard from you directly yet in response to the Supreme Court's decision about the federal carbon pricing. Now that the court's weighed in and you've had some time to think about it, are you going to change tack at all? Is Ontario going to bring it in its own form of carbon pricing? And do you have any regrets about spending $30 million of taxpayer money fighting this court case?
Well, first of all, start off with regrets. I never have regrets fighting for the taxpayers of Ontario, keeping prices low. They think $30 million is tough. Wait until the gas prices get jacked up over and over again. Everything that you buy is going to go up. It's a terrible tax. But in saying that, I respect the courts. I have a great deal of respect for the courts, and we're going to have conversations with the federal government to sit down and collaborate with them. I've always said from day one, and the Prime Minister and I, we've mentioned this, there's going to be things that we just will never, ever agree on. And then there's going to be a tremendous amount of things that we do agree on. So this is one of the few things that we're going to disagree on, but in saying that, we're going to work collaboratively with the federal government and do what's right for the taxpayers of this province.
Next question.
From Christina Tenalia from CP24. Please go ahead.
Hi, Christina.
How are you? Hi, Premier. So Mayor Tory has been urging and pleading with the people of Toronto to get vaccinated. There are thousands of appointments available. We've also just learned in the last half hour, of course, they operate separately federally, but in New York, starting tomorrow, those 30 plus are eligible to schedule and receive vaccines. And on April 6th, those 16 plus will be eligible. So when are you going to lower the age range for people here, considering in Toronto, at the mayor's urging, there are appointments available for those in the priority groups, but they're not coming. It almost seems that everyone who's wanted the vaccine has already gotten it in those groups.
Yeah, so let's go to 80 plus. 82% have either received their vaccine or they're booked for their vaccine. We have a little over 100,000 and change. I encourage everyone, please sign up. I'm talking to the mayor almost every day, and I encourage everyone, 70 plus, please sign up. Please go out and get your vaccines. To answer your other question, Christina, It comes down to the volume of vaccines that we can get. I'm going to give you one example today. We're going to get a good chunk of Pfizer, but Moderna, I think it's a fourth or fifth time we were expecting it. I think fifth time that we thought we aren't getting now. We aren't getting it until next week. So, you know, the yardstick keeps constantly moving. And then AstraZeneca, I understand, is going to land here tomorrow. And then we'll see how quickly we can get it. But I just do not understand how the federal government, they know it's landing tomorrow and they can't give us a time when it's going to land here in Toronto. We just can't snap our fingers to these pharmacies and turn them on overnight. So we just need some notice when stuff's coming. It's the single most frustrating thing throughout this whole pandemic, not knowing when you're going to get supply.
Follow up?
Premier, on AstraZeneca, we've just learned that Prince Edward Island, the province, is suspending the use of AstraZeneca because of rare blood clots associated with the vaccine. The province was using AstraZeneca in those 18 to 39 for those who already had a relatively low risk of severe outcomes from infection. This information also, I should point out, tweeted by Dr. Isaac Bogosh, who is on your vaccine rollout team. You're aware of the hesitancy people have already with receiving the AstraZeneca vaccine. Are you going to speak to Dr. Williams, considering what's just come out from PEI about rethinking this vaccine, reconsidering it? Do you have any concerns or apprehension?
Well, Christina, we'll take our advice off Dr. Williams, but again, we get the advice on what age area we go with from the federal government, and the feds are saying it's still safe for 55 plus. And I understand there has been blood clots. Some patients in the UK, female folks about 30, 35 years old. But I'll tell you, I won't hesitate to cancel that in half a heartbeat. If it's going to put anyone in harm, we just won't use it. Simple as that. But I am getting my advice off the federal government and Dr. Williams.
Next question.
From Randy Rath at CHCH-TV. Please go ahead.
Hi, Randy.
Hi, Premier. To get back to Christina's question about vaccine hesitancy and the AstraZeneca use being suspended on people under 55, you just said that you wouldn't hesitate to cut the use of it if it's necessary.
Yeah.
Isn't this going to add in an extreme way to hesitancy of people to get that vaccine, whether they're over 55 or under 55?
Yeah, again, we got updated just late last night, probably about 10, 11 o'clock at night, and the federal government will be in full discussions, as we have been since yesterday and today, to see the direction of which way we're going to go with this. But if there's any issues below 55, I won't hesitate to just say enough. I'd rather wait. It means a month or 2 months for Pfizer and Moderna and J&J, then roll the dice on this AstraZeneca.
Follow up?
So have people that have gotten that vaccine already, have they rolled the dice?
No, not at all. I'm talking about 35 years of age, and that's where they see the problems. They don't see it 55 plus. The guidance from the federal government is it is safe for people over 55. I'm talking about younger people taking it 35 years of age and in that range. That's where the problem is, not with 55 plus.
Next question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Just to get back to the carbon tax, what is the suitable way going forward then? You canceled cap and trade. You had the Supreme Court ruling last week. What are the options available to you at this point for pricing or whatever on carbon? How are you going to do that now?
Yeah, you know something, Robert, what I believe in sitting down, talking to the federal government, coming up with a plan that's going to be satisfactory to them, satisfactory to us, and we'll work it out. We'll do the right thing. But what we're doing, we're putting the largest investment into battery-operated cars, which is massive emissions that come out of cars. As we know, we're going to be the largest manufacturer of battery-operated cars anywhere in North America. And I also, we never rule out the confidence in the private sector. When they're manufacturing any sort of packaging, everything is focused around the environment on any of these major companies, making sure that they use compostable materials, the polyethylene, compostable materials, and I have confidence in them because every major company out there, that's what they're focused on.
Follow-up?
Thanks, Premier. Just switching gears back to vaccines and AstraZeneca. We are seeing cases really rise. I'm wondering, what are the criteria for the new power for the chief medical officer to put an area back into shutdown, not just lockdown, but shutdown? What are the criteria for that, and how could this unfolding AstraZeneca situation complicate things? Because there are a lot of people calling for the vaccine strategy to be adjusted to get the vaccines into the hotspots to help keep people out of ICU.
Yeah, really, we work collaboratively with the local medical officer, and when the local medical officer puts a request in, there isn't once that we've ever refused their request. And they put it into Dr. Williams, and then from there we move forward. That's what we do, Rob. It's not too complicated. No one knows their area better than the local medical officer, so we're going to make sure we stick with that protocol, and everyone's going to work together. I want to go back to the message about making sure that people are getting out there, getting vaccinated, and especially in the Toronto regions, the other regions that we moved to 70 plus. Please register. Make a phone call. Everything seems to be working well online and on the phone call, so please go out and get vaccinated. The quicker we can get vaccines into people's arms, the quicker we can get the economy back up and running.
Last question.
From Richard Southern at 680 News. Please go ahead.
Hi, Premier. Thanks for taking my call. I wanted to ask you about the situation in ICUs. I understand there's more than 400 COVID ICU patients right now, and some of the doctors we've been speaking with say if infections continue at the rate they're continuing now, the ICU situation is going to be in a very bad spot in not too much time. What new actions is your government planning to take today to prevent that from happening, sir?
Yeah, it's always concerning. I think we're at, I believe it was 82% that I saw ICU capacity right now. It fluctuates, obviously, depending on what area, but we're going to keep a sharp eye on it. And thank goodness that we put billions of dollars into increasing our capacity. When it comes to ICU and acute care beds, we've created 3,100 new beds in Ontario since this pandemic, and we're going to continue creating more capacity. But we're keeping a very sharp eye on it. And the message is here, I just got off the phone from the cabinet and Dr. Williams. The message is, number one, 50% of the cases are with younger people now. And I got a message to the young folks, guys, this party's not over. You know what I mean? You just got to make sure you follow the protocols, follow the guidelines, because what happens, you bring it home to one of your loved ones, your parents, your grandparents. It's unacceptable. When we're seeing 50% of the cases from young people, and by the way, the young people, when they get in ICU, they stay there a lot longer, so they're taking up more capacity. So I just can't stress it enough. You go down the street, and especially in Toronto, you just can't. Guys, we got to watch it. This is serious. So please follow the guidelines, protocols, and we still have a ways to go before we can loosen anything up.
Follow-up?
It just seems that your government is starting to loosen restrictions just as we're starting to see this trend. I wonder if you can weigh in on that as well. I want to press you, if I could, Premier, again about the April 12th school break. I know you say you don't want to predict 2 weeks out, but with the utmost respect, it is the government's job, I think, to try and do their best to predict that. And parents are going to need need a heads up on this. 2 weeks away. Is there any more you could say about whether or not that break is going to happen, sir?
I agree 100% with you. They need the 2 weeks. But God forbid we say we're going to close it, we're going to open it, and things change drastically. We see the numbers going up at a rapid speed right now. By the end of the week, we'll have a clear direction that will still give people at least a week to 10 days notice. But I understand people have to make plans.
Thanks, everyone.
Thank you, everyone. Thank you.